we have to sit down with them and we have to do it. But we have to get out of Maya to do it, and we can do it, and the committee has brought it up a number of times and has been more than willing to do it and to work on it. But we've always been, you know, nope, this is it, this is the only alternative we have, and that is not factual.
All right. So, warrant articles.
May I ask just one more question, please?
This can't go on all night. That's
Okay.
just, Mr. Belkonis.
I just want to point out in response to Mr. Rowe's comments is that every year we sit down with the Insurance Advisory Committee, and it is nearly unanimous amongst those members that they are very happy with the insurance plans that we offer. And although there are some that think there are cheaper plans that are out there, the benefits that are offered through the HMO Blue Plan, through the Meyer Insurance Program, are very well received by our employees, and they're quite happy with it. So if we can find the same product, Dana, cheaper, then I'm all ears, but the employees in general, there's no groundswell about people who don't like the benefits that we offer under our health insurance.
Well, I don't think Dana was saying that, Greg. I think, my understanding was that he was saying was, you may be able to buy equivalent Blue Cross insurance outside of Maya. I think, you know, I have to question that, because typically the way insurance goes, in Maya, you're one large group of a number of communities. If you go it alone, now you're your own group. And our experience factor, as far as information I have, is pretty poor. So we're better off spreading it over a larger group, right? Because that results in smaller increases, lower cost.
You're right, that has been the argument, but we have had other towns that have negotiated through, I believe it's Boston-based partners, that the firm. But there is a firm anyways that has dealt, I believe Tewksbury has done it, there's some other towns around here that has successfully negotiated a better contract directly with Blue Cross Blue Shield. And as far as we're happy with the insurance we have now as opposed to the alternatives we have been given. But we just as soon try to make what we have better if we possibly could, and we're not against saving money on both sides of the table.
All right. So, we have an article here to whether or not we are going to pass over, recommend, or not recommend Article 22, which is accepting Mass General Law, Chapter 32B, Section 18. The difference between 18 and 18A are 18 includes our retirees, current retirees. 18A adopts the chapter, but grandfathers the retirees.
Mr. Chairman?
Yes.
I'd like to state that I will not be participating in the debate or voting on the recommendation on the article, whereas I may have a family member that might be affected by whatever position the town takes. So I will be abstaining.
Okay.
Can I ask, what can we do before we may adopt this article to at least make the retirees whole for any additional cost and premium that they may incur, or it looks like they will incur, if we opt to adopt this article? Nothing?
That would require discussions amongst our staff and come back with a plan. I'm not prepared to offer anything this evening.
I'd like to make a
Michael.
comment to that, if I could. You know, I think your heart's in the right place, but I also don't think it's the right thing to do, because you guys have asked for town employees to take 0 pay raises. We've asked the police to take cut in the Quinn bill. We've done things over and over to employees over the last couple of years to help us with this financial problem we're facing. We've done it over and over. And we haven't turned around and trying to find ways to help them out. So I think your heart's in the right place, but I just think it's the wrong thing to do. I think this is, the article as written is the right thing to take on now. And I feel bad for the retirees. My family members are retirees as well, but not in this town, in other states. But it's, you know, I just think it's disingenuous what we've done to the previous employees when we asked them to take cuts.
Well, the way I look at it is, if we have a pool of money here that we know we're going to save, and if we could make the retirees whole, at least in terms of additional premium, and still have a savings, I think it's a win-win.
Are
For
you telling me
both
our
for-
bond rate will still, it won't affect our bond rate, what you're proposing? Because to me, that's a big factor in this whole thing. In our unfunded liability, I mean, those things are big factors in why
No,
I'm
no,
gonna
I-
agree to vote on it.
Michael, you may be missing the point. I'm saying
Okay.
if we adopt it,
Yeah,
but at the same time, or close thereto, be able to make the retirees, we adopt the article,
yeah,
and that addresses our unfunded liability.
yeah.
We don't know to what extent yet, but I believe the town's working on trying to get that number. Putting that aside for a moment, we're going to realize a savings here of, at a minimum, 60,000 plus. It looks like somewhere around 170,000 minimum.
Mhm.
Given the number of people it's going to affect at this point, it more than covers, I would think, doing quick math, any additional premiums the retirees will have to pay by forcing them to go into Medicare.
Okay. I follow all that.
So if we can save money,
Yeah,
and to a certain extent, make them whole,
that means
That-
give some of it back, I guess, when you mean make it whole. I
give some of that
understand.
savings back, correct?
Again, it doesn't just go against what we're trying to do.
No, because I still think we're able to save money, a substantial amount of money, without negatively affecting those that are on fixed incomes. I think we have to be cognizant of that, too. I think we have a responsibility there as well. That's my point of view.
Well, I guess I have to see what you're saying. I have to see what you're proposing.
I think Mr. Kel,
$200 a month, was it? It's $2,400 an individual?
that's what it,
That's what I heard.
I think Mr. Kelleher may be able to answer some of that discussion.
Mr.
Or
Keller.
clarify it.
The analysis that we did showed that the premium change for a single retiree, when you compare the HMO Blue plan to a combination of Medicare and the MedX plan, the premium increase for a single individual is $1,800. Okay? Offsetting that, as Abby had mentioned, is whatever out-of-pocket costs are going to be avoided by the retiree because they're in the MedX plan rather than the HMO Blue plan that has the office visit co-pays and some directives. So it's not clear just what the net impact is to the retiree. We've asked Greg and Bren's been trying to find out what the average out-of-pocket cost is for the entire population in our plan. We haven't been able to nail that down from the provider yet. But I think to the extent that there is the savings in those out-of-pocket expenses, that will mitigate some, if not all, of the $1,800. I don't know how much it is, but it certainly is something more than zero. So we're not talking about premium versus premium change to the retiree as being their net cost of going from one arrangement to the other.
I'm trying to move this thing along, Dana. I guess we're at a point, we're not ready to make a decision on this yet. It's gonna go right down to the wire on
I think so.
next, a week from Monday night. I think what what would make me feel comfortable, you know, and I understand the issue of arriving at a number, is the MedX plan is better than the HMO plan in terms of co-pays and some other things. It'd be nice to know what the difference is there. What? Yes, the benefits. Do you know?
Well, I know too, that MedX does not have, you have to realize that MedX does not pay for any benefit that Medicare does not recognize. Medicare has to pay it first, and then MedX comes in with their 20%. So if Medicare says, no, you may not have that, MedX cannot override them and give it to you. So when I went on, I lost my, I call it a gym privilege. I cannot go to the gym and get $150 back a year. And then the second thing is I've lost a lot of my annual physicals, whether it's with specialists or with my primary care physician. Medicare does not allow it. And you have to look at the Medicare book and find out what you can do and what you can't do. Because if you do go and Medicare doesn't cover it, you have the total bill. MedX does not jump in over it.
I haven't run into that, so I guess I can't comment.
Mr. Chairman, there's no referrals that are required. There's no out-of-pocket payment required for doctor visits. Presently, employees under the HMO plan pay $15, so there would be a $15 savings per doctor visit. For generic drugs, the 30-day supply, it's free, so there is no payment for the 30-day supply. For the 90-day supply of generic drugs, there's a $2 payment after a $50 a year calendar deductible is met. So in terms of how that matches up against our employees who are, and retirees who are under the HMO, and again, looking at the generics, the 30-day supply of the generic drugs is a $10 copayment. And for the 90-day supply, it's a $20 copayment. So give you a little bit of an idea in terms of just strictly looking at office visits.
What if it was, you know, a specialty drug or something on each plan? Do you have that number?
Yes, I do. The, give me a second. Let's see. For brand name drugs, the program provides 80% coverage of brand name drugs after the $50 out-of-pocket deductible per calendar year. So it's 80% coverage.
Is that MedX or,
That would be the MedX plan.
okay,
That
what's
the
the
town's-
Blue Cross plan do?
For brand name drugs, brand name drugs fall into two different groupings, but it's either a $20 monthly out-of-pocket payment by the employee or a $35 a month out-of-pocket payment by the employee. So it's between 20 and 35, depending upon where the drug
And
falls.
what's the 90 that you have there? or-
90 is $40 and $70. It's noted here that on the 90-day mail-in, and I did not mention this, that the 90-day brand name cost is $15.
That's on the index.
Correct, so that is substantially better than
What was the 80% when you missed that?
that was on the 30-day supply.
30 days.
Oh, okay.
So if you want to go to the local pharmacy versus the
Oh, okay.
mail-in prescription, that's
Because I was gonna say 80% of a very
No, that-
expensive drug is not a lot.
that
Index is $50 deductible, you said?
$50 per calendar year deductible on brand name drugs only.
But the plan is better. But it's hard to put
A number on it,
yeah, it's
right.
hard to
Right.
remember all the time.
And what-
It's gonna vary.
In order to come up with some costs, what we would do is we can't get specific information on our 16 or 25 retirees. We just can't drill down to that level. But what we can do is we can take the total number of office visits and come up with a conservative number based upon the number of visits divided by the number of subscribers that we have in the plan, and average that out and say that, on average, people visit the doctor 6 times a year. And this is what